Hi, Dr. Svehlak.
Hi.
What is liposuction?
Well, liposuction, it's very basic. Just like it sounds, you're suctioning fat out of the body using a cannula, something like this, stainless steel, goes to a suction machine, and fat is removed in that procedure.
What is the difference between liposuction, liposculpting, and lipocontouring?
Okay, so now, liposuction, like I just explained, but now when you start saying contouring, sculpting, some people use very sophisticated words, air sculpt and all this other thing. Ultimately, it still is liposuction. We're still using cannulas to remove fat, but when you start saying sculpting and so on, you're removing it in such a way to really sculpt and reshape the body, maybe removing excess in certain areas, and maybe at the same time using some of that fat to sculpt and reshape other areas by adding fat back in. So I think when you start using terms like liposculpting and so on, I think you're going to get more, you're using more of a artistic look at everything.
Do you see results immediately after surgery?
Well, with any liposculpting or liposuction, you will see results almost immediately. I mean, I see them right on the table where hips may be reduced or tummy and the waist is a little tighter and so on. Those you absolutely see immediately. However, final results can take months because of swelling and so on. You have to heal, and that could take several months.
Does fat get gained in other places?
That's a very common question I hear a lot, that they're going to gain weight in other places or it moves. It doesn't technically move or anything. Once the sculpting's done and reshaping's done, that's kind of what you get. Now, if in the future you gain some weight, you're going to gain weight where there still is fat. Your butt may get bigger, your breasts may get bigger, your upper arms may get larger because your tummy was liposuctioned and your waist was liposuctioned. It's very narrow and it has a lot less fat in it. So fat will still be gained, but in other places where there still is more fat.
What are some things I can do to help get a better result after surgery?
Okay, typically for a lot of my sculpting patients, make sure, one of the first things is make sure you do wear a proper fitting garment. You want something that stays smooth, that covers all the contours, doesn't fold or wrinkle. In those cases, you want to find one that fits very, very well with a nice snug fit. So that's the first thing. That's good in terms of a garment for 3 or 4 weeks. Other things while you're recovering, I like to have a lot of my patients do things like endermology or some sort of lymphatic massaging, starting anywhere from 1 to 3 weeks after surgery. That's going to ultimately help swelling go down quicker, bruising go away quicker, and also improve the contours long term. Another thing that's really important is don't think just because you had liposuction, you can just go willy-nilly and eat whatever you want. You still want to have a really good diet. Low sodium intake. A lot of sodium will cause you to have way more swelling during your healing. So you want to minimize sodium intake. Eat healthy. And then when it's time, 3-4 weeks down the road, you start getting into some of your routine exercising and then more aggressive stuff, maybe 6 to 8 weeks after your surgery.